Yeah. Thank you. And then he says, also, given the Alzheimer's ticking clock, how aggressive should the treatment be? Yeah, I'm so glad you mentioned that because, this is a ticking clock for all of us. So first of all of the children should be evaluated and started on active prevention, since all of the children will be ApoE4 positive if they're 45 and over. And we again recommend for everybody, no matter what your status is, if you're 45 or over, please get evaluated, please get on active prevention. If you don't do that, then certainly the earliest reversals, the longer you wait, the tougher it is. In this case, it's even more important because all of them will have that ApoE4 gene. So second, as I mentioned, the later you start, the more aggressive the treatment should be, since this is a terminal illness if it's not treated successfully. So we want to do everything possible to get positive outcomes. The good news here is that you've already identified some clearly addressable contributors. These can all be treated. And even though, as you noted, it's impractical to address all at once, you can then, please take it one treatment at a time, be diligent, be persistent. And again, we see people who are doing the right things, who are getting, who are addressing all those things again and again and again, get very good outcomes. And Anne, do you have anything further to say to Richard in terms of how aggressive to be with this?
I just wanted to add that I do see the descendants, the children, the adult children of patients of mine who are cognitively impaired, and that I see them, some of them before they have any cognitive symptoms, and I love seeing those people. It's fantastic to be able to work with someone on how to optimize their cognition long term before they have any symptoms at all. And I just wanted to remind people that there's a pre-code program that you can sign up for, part of Apollo. So, I would definitely encourage anyone who has cognitive impairment, even if you're not an ApoE4 carrier, if you have cognitive impairment and you have adult children, I think it's in their best interest for them to start a protocol, optimize their weight to height ratio, optimize their metabolism, their glucose, their hormones, etc. That all is going to make a big difference long term.
Yeah, that's such a good point. I really do believe that there could be a dramatic decrease in the global burden of dementia if everybody who's 45 years of age or older would get on active prevention. And I always ask the same question to people who are practicing. Have you seen anyone who's gotten on optimal prevention, done the right things, been compliant, and yet went on and developed dementia? I've not had a single example where someone said, oh yeah, I know someone who did everything right, but they ended up getting dementia anyway, even though they started when they were asymptomatic. Now, maybe it will happen at some point down the road, but whatever the reduction in risk is, it is substantial because we're just not seeing people develop dementia who are on optimal and compliant prevention.